Are you okay? Are you sick? You should go to the doctor. Do you want me to take you there? Okay, let's go. Okay, honey. And you are all set up. Your appointment will be Monday. Is that okay? Great. It'll be at 3 p.m. at the Cozy Hospital. All you need to do is go to the Cozy Hospital, and to the right, you should see a sign that says Cozy Clinic, and that is where you will go. That is our clinic / urgent care center, and there you will meet Dr. Reda. Great. Till I see you. Alright, bye bye now. Okay, let me just add that in to the system. Monday 7, good. Monday 3, perfect. Okay. And for Dr. Reda, good. Alright, I can take you. Please walk on a bit closer. Hello there. How are you doing today? That's great to hear. I am speaking quite low, yes. We speak this low to not worry the other patients, you know. 1, to keep your information private, and 2, to not let other people hear the symptoms that you may have, okay? Yeah, we don't want everyone around worrying. Great. So, what brings you in today? You have some symptoms. Okay, let me just get you into the system. Are you a new patient or a returning? A new patient. Okay. And you don't have an appointment. Are you here for urgent care? You are here for urgent care. Okay. Let me write that down. Urgent care, new patient, flu-like. Alright. And what is your name and date of birth? Okay. Okay. Good. And what is your preferred pharmacy? Okay. And if that pharmacy isn't available to have the medication that you may need, do you have a backup pharmacy? Okay. Great, great. Yep. Okay. Now, I'm just gonna ask you some standard questions about your symptoms and things. Yes, these questions just help us see where your sickness could have come from. Okay. Have you been around anyone that was sick recently? Okay. Are you experiencing any of the following symptoms? A sore throat. Okay. A runny nose. Okay. Coughing. Okay. Lightheadedness. Okay. Dizziness. Sneezing. general flu-like symptoms. An example would be a high fever. Okay. Great. Let me make sure I have all of that correctly. Have you been in or out of the country recently? Okay. Has anyone you know been in or out of the country recently? Great, thank you. Alright, now to schedule you into our system for urgent care, I'll just need a few things from you, okay? Great. Please hand me your ID. Great. And now, could you please pass me your social security? Great, thank you. Okay, so I am having an issue running your social security. Let me ask you a few questions to make sure everything is okay on your end, okay? And if I still cannot resolve the issue, then I will call your insurance. I'm sorry, I meant your insurance, not your social security. Yes, that would be funny. You would not be a person if your social security wasn't working. All right. Is your insurance card new? And how new? Okay. Is it all paid off? Okay. Is it up to date with anything new, like an address, a phone number change? Okay. And have you recently moved? Homes have a new address? Okay. So I am still having issues with your social security, but not to worry. What we're going to do is we're going to call your doctor. So sorry. My brain is scattered today. It's been a very long day. We're going to call your social security for you, okay? Yes, please wait one moment. Hello. Hi, my name is Rose. I work at the Cozy Hospital, and I have a patient here trying to use your insurance. Yes, we do accept the insurance listed on the card. Sleepy Dreams Insurance is one of the insurances that we collect. Yes. So it seems like I'm just having an issue running it through our system. Every time I'm trying to run the insurance, it says that our wonderful patient here is not a member. Okay. Yes. So their group number is 25, 26, 37, 48, 50, 62, 31. Yes. And they're... Okay, I'll give you a second. Okay. Okay. Their address on the card is 2526 Soft Dreams Lane. Yes. Okay. Okay, great. I'm glad you were able to find them. Yes. Okay. All right. Yes, I'll let them know. Thank you very much. Have a great day. Bye bye now. All right. So, your insurance card is so new that it wasn't completely filed in the system yet. Yes, well, usually they file it before they ship it off, but since you were a new patient, they have an influx of patients recently, okay? So it was a mistake on their end, but they are fixing it. If it still isn't fixed, please do call them again, okay? Great. So now that your insurance is registered, I can put you into our system. Please give me 1 second. Yep. And I just gotta put this in, put in this here, and okie dokie. Alright, so you are officially in our system. Are you planning on being a returning patient to this hospital, or do you have your own primary care physician? You don't know yet. That's perfectly fine. If you do ever come back, we'll have you in the system so you won't have to go through this long process again, okay? Great. So, now here is what's gonna happen. I am going to pass you this clipboard, and this clipboard will have a couple of questions that I would like you to answer. So, I'll run through them with you because the sheet can be a bit daunting. We are asking for your known allergies, your most recent health evaluations as far as mental health goes, any known diseases or illnesses that you may have. Yes, just things like that. There are also 2 consent forms, okay? The first consent form is asking for permission to evaluate you today. So, just to see you, run you over, give you medical exams. And the second consent form is just asking if it is okay for our doctors to prescribe you medicine. So, let's say you need a shot or something like a prescription pill, then this will let us give those things to you, okay? Yes, and don't worry if you feel uncomfortable with receiving medicine or being given medicine, you can just say no to that part. But if you do need to be seen and evaluated today, unfortunately, you do have to say yes to the other consent form. Great. Okay, this is for you. Yes. All right, so once you fill that out, you can just bring it back to me, okay? Great. And so, what I would like you to do is please take a seat. Your number will be 25. And when you hear 25, please stand and walk over, and they will lead you to the doctor and do some other health exams on you before you can be seen, okay? Great. All right, now, I hope all of your issues are solved. Okay, bye-bye. Number 20, please follow me. Number 30. Number 2. Number 5. Number 10. Number 13. Number 25. Number 25. Number 25. Come on over. Follow me, please. Hello there. My name is Diamond, and I will be the nurse. So this will be your room. And when we go in, I'm gonna have you do a couple of tests. Okay. The first thing I'm going to have you do are just take your vitals and things like that. I'm gonna ask you some questions about your symptoms, and then uh, we'll get started. Okay, the doctor will come in after I'm done. Oh, follow me in. Okay, so now it is time for me to do a series of tests on you before the doctor gets in. I'm going to take your blood pressure and check your vital signs, okay? They'll be super duper quick, and then the doctor will come in and she will handle the rest, okay? Okay, so, all right, your name, let's write that down, and your date of birth, okay. Your reason for visits, yes, that is correct, and that is also correct. Okay, so let's get started. The first thing I want to do is take your vitals. So, what I would like you to do is, could you please stick your arm out for me? Okay. I'm just going to take your pulse, okay? Flip it the other way, please. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13. All right. So, your vital signs look pretty good. Let's write that down. Next, I'm going to take your temperature, okay? Please bring your head close to me. Okay. Yes. You are pretty warm. Okay. Great. And the next thing I am going to do is I am going to check your blood flow. Can you flip your arm over for me, please? Okay. Your veins look pretty good. Next, I'm going to check your oxygenation. So once again, hold your hand out for me. I'm just going to squeeze onto your finger. Great. That looks pretty good as well. Alrighty. And do you have any other symptoms that aren't mentioned on the form that you filled out? Great. All right, so I will be giving this to the doctor, and she will come in to examine you soon, okay? And any other issues or concerns that you have, you can let her know. Alrighty. Hello there. I am Reda, and I'm your doctor. Are you ready to be seen? Alright. According to your chart, it says here that you came because you had some general flu symptoms. It says you have a cough, a sore throat, a runny nose, and some sneezing. Yeah? Okay. And it also says that you are running a high fever and that you have not been around anyone sick. And okay, so we are going to get to the bottom of where these symptoms could be coming from, okay? So, first things first, let me go wash my hands and then I will begin a thorough examination on you, okay? Okay, so now that my hands are nice and clean, I am going to give you a general exam, okay? And the first thing I'm going to do is I'm just going to feel your scalp and I'm going to check for lumps and bumps. And then afterwards, I'm going to feel a bit deeper. And what I'm going to be feeling for is for pain and tenderness, okay? Okay, here we go. As I am feeling your head, I don't see any lumps or bumps so far. I don't see any dandruff or dermatitis. I don't see any redness, any signs of scalp psoriasis, no discoloration, or indications of skin cancers on your scalp. As I look near your hairline, I'm not seeing much. I'm looking at your bang, this little area where you'll get the most sunlight, and I am not seeing anything. Okay. I'm looking at the ends of your hair, and you take good care of your hair. It seems to be very moisturized, well oiled. Okay. So, overall, it looks like you take really good care of your scalp and I cannot see any issues. So now I'm going to go through, I'm going to press in areas, and if you feel pain, just raise your hand, okay? Alright. So, do you feel pain when I massage you here? Okay. Do you feel pain when I massage you here? Okay. What about pain here? Do you feel any pain when I massage you here? Okay. And what about here? Do you feel pain when I massage you here? Okay. And here. Do you feel pain when I massage you here? Okay. And if I touch the back of your head, do you feel pain when I massage you there? Okay, so you seem to have a lot of pain near your face and scalp area, and that could be due to some sinus pressure and sinus pain radiating up. So, what I'm going to do is I am going to take a look at your face, okay? And what I'm going to do is I'm going to take the flashlight, I'm going to put it on your face, and I'm going to see your red light reflex. And typically that's in the eyes, but I could also do it in your face, and it'll show me if an area lights up, it'll show me you have a lot of sinus pressure there, okay? So I'll be looking at your forehead and your T-zone area, all right? Okay, let's get started. So I'm looking for your red light reflex. All right, you do have it there. And here, yeah, you do have it here as well. And above your lip, yeah, you have it there as well. Let me check here. Okay, and on your forehead one more time. Okay, I'm just gonna check again just to double check my findings. Okay, and okay, all right, okay, your forehead, okay, and okay, all right. So, your red light reflex, I can really see that it's a lot going on with your sinuses, which is telling me that you do have a lot of built up sinus pressure from the sickness that you have. Okay, great. And so, the next thing that we're going to do is we are going to just examine your face, examine your skin, and then we'll examine your lymph nodes, okay? And we'll just examine all the way around to make sure that there isn't any blemishes or things like that, okay? So, let's see. Okay. Your skin so far looks very, very clear. Yes, it looks like you have a very good skincare routine and that you take pretty good care of your skin. I'm not seeing any blemishes. I am seeing a bit of redness from your sickness, specifically around your nose area. It does look like you've been rubbing on your nose a lot, have you? It looks very irritated. Okay. And around your eyes as well. Have you been coughing very hard? Yeah. Okay. Yeah. Let me see up here. Okay. Can you turn your head this way, please? Okay. Yeah. You seem a little swollen in this area close to your ears. Can you turn this way, please? This way. Okay. Yeah. Okay. All right. And look forward one more time. Okay. So it really does seem like your skin looks very good so far, and that's great to see. And so the next thing I'm going to do is I'm going to check your eyes and make sure all of your eye functions are okay. You can look at the cabinet behind me, okay? Let's start. Look straight. Look a little bit forward. Okay. All right. And now I am looking at your eyes. All right. First thing I'm going to do is I'm going to pull your conjunctiva down. Okay. It's pink and moist. It's a little bit of watery and a little bit of bogginess. Okay. And the conjunctiva for this eye, I'm just going to pull it down. Okay. It is pink and moist, a little watery, and a little bit of bogginess as well. Okay, and now I'm going to cover this eye, and I'm just going to check your eyes. Okay, that's good. Okay, that is good as well. And what I'm checking here with this swing text is I am checking your reflex. I'm trying to see how well your eyes coordinate with each other, okay? So I'm trying to see Do they work well on their own? Do they constrict? Things like that. And your eyes are doing well. Okay, and now I am going to pull up on your upper lid. Okay, that looks good. And I'm gonna pull up on this lid as well. Alright, that looks good. Now I'm going to swing the light in your face like here or there, and I just want you to raise your hand when you see the light coming into your face, okay? Alright, ready? Here we go. Let me know when you see the light. Good. Let me know when you see the light. Good. Let me know when you see the light. Good. Let me know when you see the light. Good. Let me know when you see the light. Good. And let me know when you see the light. Good. Now I'm going to put the light in certain places, and I just want you to tap your nose and then tap the light, okay? Alright, here we go. Tap the nose and tap your light. Good. And tap your nose and tap the light. Good. And tap your nose and tap the light. Good. And tap your nose and tap the light. Good. And tap the nose and tap the light. Good. So your eyes can see when things come out of your peripheral vision well. Your eyes constrict and react pretty well as D, and your hand-eye coordination works pretty well as well. So now the next thing I'm going to do is I'm going to look deep, deep, deep into your eyes, and I'm going to try to find your red light reflex, okay? Okay, starting with this eye, I'm looking deep, deep, deep into your eye, and I do see a red light reflex. Good. And now with this eye, I'm looking deep, 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 deep into your eye, and I do see your red light reflex as well. Good. Alright, that looks pretty good. So while I have you here, can you tilt your head up for me, please? Good. And now I'm just going to quickly look into your nose. I'm looking inside your nostrils. It is pink and moist on the inside. It is a little bit of buildup of what you would call snot, but that is probably because you are sick. And your nose does look a little closed, which is probably due to the sickness as well, which may make it a bit hard to breathe, okay? But all in all, it looks good. Alright, and can you open your mouth for me, please? Alright, it looks nice on the inside. Okay, okay, so what I'm seeing is there does seem to be a bit of sickness going on, okay? Alright, the next thing I'm going to do is I'm going to take a look at your ears, okay? Can you turn just a teeny bit towards me? The other way. Good, okay. And I'm just going to look, and your ear here looks nice. I'm not seeing any cerebrum wax build up. I'm not seeing it come out. Okay, now I'm just going to pull on your ear and tell me if it hurts. Does this hurt? Raise your hand if it does. Okay, does this hurt? Okay, and does this hurt? Okay, and so now, did that hurt? And so now what I'm going to do is I'm going to look deep inside your ears, okay? So turn again, and I am just going to look deep, okay? And I'm going to pull up and back on your pinna. And what I'm seeing is you do have a little bit of cerebrum wax, but it's not too much. It's like a normal amount. And I can see Your eardrum is white and pearly gray, and everything looks good. Your ear canal is clean. Okay. And now I'm just going to do an outer exam, and it looks fine. Yeah, it looks nice and clean. There is no earwax coming all the way out. There's no bumps, lumps. Everything looks pretty good. I'm gonna pull. Does that hurt when I pull? Okay. Does that hurt when I pull? Okay. And does that hurt when I pull? Perfect. All right. And now I'm gonna look inside your ear. And so I'm looking deep into your eardrum. Good. I can see all the way back. There's no wax in the way. It's a little watery in here, but that's fine. And yeah, this ear looks pretty good. This ear seems to indicate a little more that you're sick than this ear. So I'm leaning towards a common cold as the issue, okay? And so the next thing that I am going to do is I'm going to check your lymph nodes, okay? So I'm gonna start here in your collarbone, and those feel pretty good. I'm gonna check underneath your neck, and these feel a bit swollen behind your ears. Yeah, all of this feels really swollen down your neck. Those feel swollen, and into your shoulders feels pretty swollen as well. Okay, now can you raise your arm in the air for me? This one. Or we can do this one. And I'm going to palpate underneath, and the lymph nodes in there feel a bit swollen as well. Have you been feeling pain here? Okay, and can I see your other arm, please? Okay, and the lymph nodes in here. Yeah, this feels swollen as well, and you haven't been feeling any pain. Alright. And I'm going to touch your neck once again. And the lymph nodes here, they are movable, which is good. Yeah, they're all mobile, which eases my concerns. Yeah, okay. So that is all good. And okay. So the next thing I'm going to do is I'm going to give you an abdominal exam. And after your abdominal exam, I'm going to check your feet, okay? So please lay flat on the bed and we'll get started. And now let's look at your stomach, okay? I am just going to feel your belly, and I feel no tenderness, no hardness, and it doesn't seem painful, which is good. I'm going to shine a light on your belly to give it a good look over, okay? Here we go. And so I'm looking at your belly, and yeah, this area looks swollen. It looks a little hurt. Did you eat something that tasted a bit funny? Okay. So that is a bit concerning. It looks very painful. All right. And the next thing I'm going to do is take a look at your feet, okay? And now I'm just touching your feet. Is that painful for you? Okay. And what about here? Is that painful for you? Okay. They seem a bit swollen, which has me concerned that there are some more issues going on. A lot of your lymph nodes was swollen as well. So I think this might not be a typical sickness, seeing as your feet are swollen and your lymph nodes are swollen, okay? Okay. Yeah. So that doesn't seem okay. So there does seem to be something wrong going on here. So what I'm going to do is I'm going to give you a antibiotic shot. You could sit up, okay? So this shot shouldn't hurt. You should feel like a little prick, and this is basically going to try to calm down the systems in your body. And after a few days, I would like you to come back so we can run some more exams on you to see what's wrong and what's going on, okay? So you stick out your arm for me. Okay, and 1, 2, 3. Good. All right, and that is it for your visit. A nurse will come in to help you fill out your discharge papers, and I do want to see you again next week, okay? All right, goodbye now.